All right, welcome to The Explainer. Today we're diving into a really formidable medical condition, one that's been stumping doctors for the better part of a century. We're talking about a true silent killer that strikes from right inside the gut. Now, I want you to just listen to this. Back in 1930, a physician named A.J. Kokonis used 3 words to describe this condition: impossible, hopeless, useless. I mean, that tells you everything about the sheer gravity of what they were dealing with.
So you have to wonder, has that incredibly grim outlook really changed? We're going to use that quote as a jumping-off point for today's explainer, kind of like a medical detective story, to figure out why this one condition is still one of the biggest diagnostic challenges in all of medicine. So what do we call this thing today? Well, the modern term for what Kokinis was describing is acute mesenteric ischemia. And you can really think of it as a silent attacker. It's a stealthy and deceptive opponent that does a terrifyingly good job of hiding what it's really up to until it's almost too late.
Okay, so let's break that down. Acute mesenteric ischemia, or AMI for short, what it means is that the blood supply to your small intestine gets suddenly and severely cut off. To put it really simply, your gut is literally being starved of the oxygen and nutrients it needs to live.
And this right here, this is the absolute heart of the mystery. The reason it's so incredibly difficult to catch is that the first symptoms, things like abdominal pain, are just so nonspecific. They could be a sign of dozens of other things, most of which are way, way less serious.
So you've got this diagnostic fog, right? And what that creates is this frantic, high-stakes race against the clock. For the patient, for the doctors, every single minute that takes by, the damage inside is just getting worse and worse. So what are the stakes in this race? What is actually happening inside the body when that diagnosis gets delayed? This timeline shows you just how terrifyingly fast this whole thing escalates. In those first few hours, you've just got those vague, confusing symptoms we talked about, but all the while, the blood flow is still blocked, and you enter this critical window where the bowel tissue is really, really starting to suffer. If you don't fix it, you hit the advanced stage, widespread tissue death, what doctors call necrosis, and that, tragically, is permanent. And this is where the story often takes a really dark turn, because the full, devastating picture, well, that often only becomes clear once you're inside an operating room. It's the moment of the grim discovery.
It's kind of wild to think about. But because the symptoms are so misleading, the only way to get a definitive answer is often through abdominal exploration. A surgeon has to physically go inside to find out what's really happening.
And once they're in there, the surgeon is faced with one of 2 very different realities. In one scenario, they find a bowel that's in deep, deep trouble. It might show signs of something called pneumatosis intestinalis, that's gas cysts forming in the walls, but the tissue, it might still be alive, still viable. The other scenario is finding what the medical books call frankly necrotic small bowel. And that's just a clinical way of saying the tissue is visibly dead, it's gone, there's no bringing it back. That moment of discovery on the operating table, it changes everything. For the patients who actually manage to survive this crisis, life after ischemia is profoundly and permanently altered.
See, the only way to save a patient with a necrotic bowel is to surgically remove all of the dead sections. It's a procedure you absolutely have to do to stop a fatal infection, but it comes with a huge, lifelong cost. And that cost, it has a name: short bowel syndrome. It's what happens when you've had to remove so much of the small intestine that your body just can't absorb enough nutrients from food anymore. This can mean a lifetime of needing IV nutrition and all kinds of complex medical care. And this brings our whole detective story right back to the beginning. This devastating, lifelong consequence isn't just because of the disease itself. No, it's the direct result of losing that initial diagnostic race, a race that, even with all our modern medicine, is still incredibly hard to win.
So it leaves us with this final massive question. In our era of truly advanced medicine, with all the incredible technology we have, how do we get better at unmasking a silent killer that is still hiding in plain sight?